I am not a medical professional. If you believe you are experiencing a condition, please speak with your medical provider. My goal as a full spectrum holistic reproductive practitioner is to bring awareness to different conditions and how holistic care can support the body to heal. Let's talk about edema. What is edema? Edema is a condition that was once called oedema. This is where fluid builds up, and the retained fluid can cause swelling within the body. Edema is more commonly noticed in the feet, ankles, and lower legs. This condition can also affect different areas, such as the arms, hands, face, or even the torso area. It is important to speak with your medical practitioner if you notice this condition is not improving, as it could lead to more serious health concerns. Edema can affect anyone. However, it is a very common condition during pregnancy as the body retains that excess fluid. Many individuals who become pregnant will notice their feet beginning to swell. This could be a sign of preeclampsia, where one of the symptoms is swollen hands and feet. I will be posting a video shortly to discuss more on this condition known as preeclampsia. For now, let's just stick with edema. What is the cause of edema? Well, there are many different factors that can play a role in causing this condition, such as sitting often or having long periods of immobility, and this is due to the effect of gravity. Genetic characteristics, trauma or injury, side effects from different medication, pressure on blood vessels from the uterus during pregnancy. So during pregnancy, your body actually retains 50% more bodily fluids and blood volume. Eating too much salt, lymphatic issues, so your lymphatic system is your immune system. Venous issues. Now, this would be any issues that are affecting the veins. Age can play a role in the cause of this condition. So, as you become older, the veins in our bodies don't work as well against the effects of gravity. And so, this is why, as we grow older, edema is more common. Issues with the heart, liver, or kidney could also play a role in the cause of this condition. And this could be the cause of a more serious case of edema. How is edema diagnosed? Your medical professional can diagnose this condition with an examination. If they notice an area that is swollen and leaves an impression after pressing into the area for about 15 seconds, they may suggest that you actually have edema. Further testing may then be done, and this is to diagnose the cause of edema. Your doctor will want to rule out any potential health concerns. As mentioned, there are many potential causes for this condition, and so it is very important to speak with your medical practitioner regarding any concerns. Some questions that you may want to ask your medical professional may be, what is causing my edema? What treatment is best for me? Is it safe for me to exercise? Should I wear support stockings? What lifestyle changes should I make? Can you recommend any books or websites where I can read about low salt diets? Is air travel safe for me? Or will my edema go away? So those are just some questions that you could ask your medical professional. And it's always a good idea too to even bring a notebook along so that way you can jot notes down as you're having your appointment. So throughout your appointment, because when you're seeing your doctor, sometimes the information that they're giving you can be very overwhelming. And so just having that extra tool, that notebook that you can refer back to, can be very beneficial. How is edema treated? If this condition is not severe, it will usually just go away on its own. However, if the condition is more severe, there are different remedies and things that one may want to consider, such as compression garments, different massage techniques, exercise, stretching. So you could try different yoga techniques, a diet change. And so this is to try to reduce the intake of foods that are high in saturated fats and the unhealthy salts. When laying down, keep the legs elevated above the heart level. So you can use a pillow to help raise your legs up for that extra comfort and support. Medications such as a water pill, and this is to help flush out excess fluids and salt through urination. Now, if this condition is left untreated, it could cause other such things as increasingly painful swelling, difficulty with walking, stiffness, stretched skin, and this can become itchy and very uncomfortable. Increased risk of infection within that swollen area. Scarring between layers of tissue. Decreased blood circulation. Decreased elasticity of arteries, veins, joints, and muscles. And increased risk of skin ulcers. And so again, this is something that you really want to talk with your medical professional about, or your doctor, especially too if you are considering or if you are pregnant. Pregnancy and edema. So let's talk a bit about how pregnancy is affected by this condition. As mentioned, edema is quite common during pregnancy. In fact, about 3/4 of individuals who are pregnant can experience this condition. And so, even though it may seem like a normal experience because it is so common, it is very important to speak with your doctor or medical practitioner because this could be an indication of a more serious blood pressure disorder, which is known as preeclampsia. As a secondary treatment to support the healing of edema during pregnancy, you could try different things such as moving around as much as possible. So just trying not to sit or stand in one position for too long. Try to use gravity to your advantage. Stay hydrated, so drink lots of water and try to lessen the intake of caffeine. Balance your electrolytes using the healthy salts. Be cautious of your diet. Exercise. Drink a tablespoon of apple cider vinegar diluted with a cup of water or two. Take a nice relaxing Epsom salt bath. Use a skin brush to help massage the area of concern. Or you could even go swimming to help with the effects of gravity, which could be playing a role in causing edema. Edema and holistic treatments. So there are different ways one may wish to manage this condition. After speaking with their medical professional, they may wish to try a secondary holistic treatment like reflexology or Reiki. It has been noticed that massage is very beneficial to supporting the body in healing and offering some relief when it comes to this condition. During a reflexology session, if you have swollen feet caused by edema, you can notice a difference after just one session. As a full spectrum holistic reproductive practitioner, I am also a reflexologist trained to work on different points within the feet, such as the chest and breast lymphatics to stimulate the movement of lymph, the lymphatic drainage point for fluid balance. I would also work on the hypothalamus reflex point, and this is for regulation of homeostasis and water balance. Now, these are just a few of the points that I would focus on during a reflexology session with a client who may be suffering from edema. A full session with me is around an hour long and can be very relaxing and beneficial for supporting the body with healing and, again, offering some relief when dealing with this condition. So now let's talk a bit about Reiki. The word Reiki is actually made up of two different words. You have the beginning, so you've got Rei, and then you've got the end of the word, which is Ki. Now, we're going to break that down a little bit and discuss it here in just a moment. But for now, let's just talk about the benefits for Reiki when we're dealing with edema. And so energetically, this condition can be associated with grief and sorrow, the need for control and where that might stem from, finding it difficult to enjoy life, a difficult relationship with oneself, and struggling to nourish oneself. Negative experiences or emotions can greatly affect our ki, causing what I like to call dis-ease within the body. Now, Reiki can help to clear away those negative energetic blockages that we sometimes hang on to, restoring the ki so we feel at our very best, living happy and healthy. Now, I mentioned a moment ago that I will get into a bit more about Rei and Ki. So when we break the word Reiki down, Rei actually means universal spirit. Ki, which is actually also sometimes known as Chi, is known as life force energy. So I've put a few pictures over here to show you what that life force energy can look like. And how is this, done? How are these photos taken? This is with Kirlian photography. So this is a collection of different photographic techniques that are used to capture this life force energy in all objects. It is named after Semyon Kirlian, who in 1939 actually discovered this style of photography. So this is, I find, very interesting to look at, especially when trying to understand Reiki and when we're talking about energy and, how our emotions and that can affect our energy. So yeah, take a look at this. Maybe do some more research on Kirlian photography because it can be very, very interesting. And so thank you all for taking this time and watching my video to learn a bit about edema and some of the things that can be beneficial for this condition. As a full spectrum holistic reproductive practitioner, my goal to making these videos is to bring more awareness to such conditions and our bodies and different holistic practices and such. So make sure to like this video, share it, let's spread that awareness, and subscribe to my channel. As like I said earlier, I'm going to be making more content and more videos. I'd like to do a video on preeclampsia. So yeah, there's much more coming, so stay tuned. If you would like to book a reflexology session for yourself, or maybe a Reiki session, go ahead and scan the QR code. It'll take you right to my website, Holistic Health Trust, Allow, Flow. I am a reflexologist, and I am also trained in Usui Reiki levels 1 and 2. So like I said, go ahead, check out my website. There's lots of information on there, and you can book your very own session if you're interested. So once again, thank you all for taking this time, and stay tuned for more.